Here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna here with Clear Chiropractic. I've got a video today about an interesting link between what's happening with your digestive system and how it affects the health of your bones and also the joints and the muscles of your spine. This is actually a really interesting article that I just came across, but I'm also then going to take a little bit of time to take you through some of the different things that you can be looking at to make sure that your bones are going to be as healthy as they possibly can. So please, if you don't already subscribe to the channel, click that like and subscribe button. It'll help other people find this particular information. Let's jump into it. Okay, brand new research, 2025. Gut disc axis, a Mendelian randomized study of the relationship between gut microbiota and cervical spondylosis. Gut microbiota are the bacteria that are supposed to be there living in your digestive system, and cervical spondylosis. That is degenerative arthritis. You know, oftentimes people think arthritis is something that just happens because a person's getting older. That is not necessarily true. What it is it's actually where you've either A, had an old physical injury, or B, you've been doing a lot of repetitive stress movements that over time are causing wearing and tearing through the joints, through the bones, and that are leading to damage accumulating over a period of time. Kind of like rust that you would see on a bike that's been left out in the rain for a few months, a few years, or a few decades. But these researchers, what they found is that if you have a disruption in your gut, it can actually accelerate that process. But similarly, it can also help protect that process. So I'm not going to read this out loud for you, but let me highlight some of the more interesting little things here. So firstly, cervical spondylosis, it's a degenerative disease characterized by neck pain, dizziness, myelopathy, which is tingling down into the hands, tingling into the legs, even low back pain, or structural changes and even loss of horizontal gaze. Reason for this is because joint receptors in the neck, they tie into the balance coordination centers of the brain. So if you find that your vision goes blurry when you're looking over to the side, it's not always your eyes, it can be your neck. Now here's some interesting numbers here for you. In 2017, it was reported that basically 290 million people worldwide suffered from neck pain and 29 million being disabled from it. So that is a huge number if you think about it. Now the gut microbiota, often called our second genome because there are more cells in our digestive system than there are cells in our body, plays a key role in various histological or tissue functions, including metabolism, immune defense, infection, protection, regulation of intestinal barrier structure integrity, and regulation of the nervous system. What happens in your gut affects your nerves. Recently, the emerging paradigm of the gut-bone axis and gut disc axis has gained attention, revealing the microbiota's role in digestion, metabolism, immune function, and its influence on bone metabolism through different mechanisms. Some researchers have found some protective bacteria are more common in normal discs, while harmful bacteria are prevalent in degenerative discs. And I can give this kind of as a bit of an example you might be more familiar with. Your mouth is going to have a huge amount of bacteria in it at normal times. The problem is if you have abnormal growth or bad bacteria get in there, they start to infect your teeth, and that's what's going to lead to cavities. Well, what we're talking about here is essentially cavities of the bones, but that comes in through the digestive system. And even if it's not causing sepsis or blood infections, it can still cause low-grade infections that cause damage over a period of time. Other studies have shown that gut microbiota, particularly those of the Burkholderiales order, can increase osteoclasts and reduce the risk of postmenopausal osteoporosis. Osteoclast is a cell that breaks down bone cells. They're necessary for normal tissue repair, but if they are overactive, it can cause a decrease of bone density. Now, here was the really interesting part to me. what the researchers did. They did what's called Mendelian randomization using gene variation as a tool to assess here's the interesting part, causal effect of exposure on outcomes. A lot of times with research, what we're looking for are correlations. Is there a correlation between A and B? But what these guys were looking at, by looking at different things with genetic markers, they were looking for causal relationships, that A causes B. So it mitigates some inherent issues in observational studies, such as confounding the reverse causality, confusing cause and error, by leveraging the random allocation of gene variants, providing more reliable causal interference. So simply put, what they did was they took a whole bunch of people and they compared genetic profiles of the individuals, and they compared genetic profiles with the bacteria that they identified in the gut. And I will scroll forward here. What did they found? They found that there were 15 groups of bacteria that offered a protective effect for the health of your bones and of your joints. But what they also found was they found a whole bunch of other guys that are actually involved in causing more damage to your gut. So I will scroll down to this little page right here where they're all highlighted. I'm not even going to pretend to try to pronounce some of these, but simply put, what I want to highlight here for you is that the health of your digestive system affects the health of your bones. So people are oftentimes asking us, what can I do so that I can have healthier bones, healthier joints? Certainly, we need to make sure that everything is moving the right way, not too much, not too little. We also need to make sure that you're not going to be doing daily activities that are putting undue stress or pressure on your joints. Working on a jackhammer all day, looking at a computer all day, the kinds of things that they build up over a period of time. But what we also need to do, we need to look at the health of our gut to make sure that our bones and joints are going to be as healthy as they possibly can be. Now, because there are so many different bacteria involved with the gut, honestly, you can't go through the entire list of them and say, well, I need to eat these particular foods and I need to avoid these particular foods. It's far more complex than that. But what I can do is give you some insight into the kind of things that are going to promote more of the bad bacteria in your gut, and also some of the things that you can do to promote some of the good things that are in your gut. So firstly, let's look at the things that destroy the good guys. I'm going to start first with medications. Number one, kind of the obvious one, antibiotics. There is a time and place for antibiotics when they need to save your life when you are dealing with a bacterial infection, whether in your lungs, in the blood. If your immune system is compromised, you're going to probably need antibiotic treatment. The problem is if they are overprescribed. They will damage, they will wipe out the bacterial lining of your digestive system, and it lays the stage for where bad guys can get in there. You might remember it was an old commercial where they show a little set of scales where they've got the good guys over here, yay, and then they've got the unhappy guys over here, ugh. And if the scale ever tips where you have too much, well, I'll do it this way, too much of the bad guys and not enough of the good guys, that then is what's going to set us up for sickness. So prolonged antibiotic use, that's number one. Number two, non-steroidal anti-inflammatory drugs, NSAIDs. This includes aspirin, this includes Tylenol. They damage the bacteria and they damage the digestive lining, set you up for infection, and now we know decreased bone health. The last one, proton pump inhibitors. People, if they're dealing with chronic reflux, gastrointestinal disease, things like that, they're oftentimes prescribed PPIs to quote-unquote reduce the acidity in the stomach. The irony is a good chunk of the time, it's not actually too much acidity, it's too little. And over a period of long time, taking PPIs, unfortunately, it affects the balance of the bacteria in your system. And again, it doesn't mean that there is not a time and a place for these medications, but what it does mean is if you are taking these medications for any reason, you need to be able to offset the deleterious effects the best way that you possibly can. So that's number one, the medication side of it. Number two, It's the food and the foodstuffs that you put into your body. These are the types of things in particular that are most likely going to feed the bad bacteria. Number one, and also damage the good guys. So number one, any type of food additive. If you can't pronounce it on the label, it's not going to be good for you. Number two, this one should come as absolutely no surprise, alcohol. Alcohol damages cells. Human beings are interesting. We're the only species that deliberately put something into our body that we know is bad for us. Now, as I'm going through these, I want to be clear as well. Everybody should have a little bit of sin in their life, but if that exception becomes the new rule, and if you are having simply put too much of this, this is not going to be good. Everything in moderation. Don't tip the scales too far here. Next one is going to be sugar. And this also can include too many fruits in particular. Fruits are very high in sugar, let alone if it's the high fructose corn syrup that you're going to see as many additives or in soft drinks. All of this is going to overload the bacteria in your digestive system. It contributes toward diabetes, which lowers the immune response, which then in turn is a feedback loop and just makes the basically the environment down in your digestive system much worse. You are far better off if you kick the sugar, and this also includes things that metabolize down into sugar. That is going to include your grains. So that's the wheat, that's the potato, that's the carrot, that's the corn, that's the rice. It's all of those different kinds of things, not just the simple sugars. Even worse, though, are the artificial sugars. Aspartame, sucralose, even stevia. These things metabolize down into things that are going to disrupt your body's immune system. It disrupts hormone balances, and some of them are just straight up neurotoxic. But we think, oh, but it's not sugar. It's not any calories. It causes damage. That stuff, you'd be actually better off just having straight pure sugar than these kinds of things. Next up, hydrogenated fats, or the trans fats. These are most commonly in the canola oils, the seed oils, or your margarines, or anything that in nature it would be in a natural food form, but it's been processed in a way that is no longer good for you. Trans fats, they just simply put bad all the way across the board. We already know this from diseases of the heart, but it also affects your digestive system. Last one then is a lack of fiber. Simply put, if your gastric motility is not moving the way that it should be, you're dealing with things like chronic constipation. You have the accumulation of toxins in your digestive system that throws the balance out even more. So these are a few of the things that you want to be avoiding. There's other things that maybe you've been exposed to, either on purpose or by accident, that you weren't even aware of, that causes damage to the lining of the cells of your lungs, of your skin, or of your digestive system in some way that, again, it sets the stage for abnormal growths. So first one's going to be heavy metals. This is going to be if you've lived in a city. If you have been in a place where, for example, you like to do a lot of cycling, but you do it on the road, so you're always behind car fumes, different things like that. But it can also be if you've ever had certain kind of substances, shall we say, grafted into your mouth. I'm referring to amalgam fillings. This is neurotoxic, and it has an affinity for your adrenal glands, the thyroid, your digestive system, but also the brain. Not good stuff. Also, pesticides. Pesticides also very neurotoxic to the brain, but also digestive system, especially if you've grown up around agriculture in rural areas, or if you are eating foods that have been exposed to these things. Even if you wash them, certain trace amounts of these can build up into the cells of the foodstuffs itself. And it doesn't have to be massive dose exposures, just a little bit over a long period of time, not going to be good. This includes if you are working around a lot of things that use glycophosphate, so Roundup. So you've done a lot of weed killing, you've done a lot of lawn maintenance or lawn care over the years. These types of chemicals, they build up in your body, they cause damage, they throw things out of whack. and it can lead to what's known as SIBO, small intestinal bacterial overgrowth. In a nutshell, this is that process that we're talking about where you suddenly have way too few of the good guys and way too much of the bad guys. So this sometimes needs a combination of different therapies. If the overgrowth is pronounced enough, various cleanses might be necessary, and indeed it might be necessary to also take, for a certain period of time, antibiotics to simply wipe out the bad guys so that you can start anew. And I'll get onto that in just a little bit, but I repeat, time and a place for certain medications, especially if things are so out of control, you just got to get them back under control. But other factors that can also influence bacterial overgrowth, number one is going to be parasite, and it is actually remarkably more common even in the United States than you would even think of. Parasites, if they're growing in the digestive tract, they're going to be siphoning energy away from your cells. It produces a bit more of an imbalance. Same thing goes, I don't have it written here, candida overgrowth. So this usually comes from when you're dealing with too much sugar. And the other one, also super common, you wouldn't believe how common this one is, mold. Mold is never something to muck around with. It can mimic so many symptoms: chronic fatigue, fibromyalgia, chronic regional pain syndrome. And what it does is it's producing an overgrowth on the inside of you. Mold is a living organism, and it doesn't necessarily have to be in the house that you currently are living in. It can be something that you were exposed to as a little kid, but unfortunately it's been growing and maintaining residency in your body, producing an abnormal load. As a hint, if you ever suspect that you might have a mold overgrowth, there's two things that I've observed with this over the years. Number one is if you ever take an antibiotic for a genuine reason and you feel so terribly much worse after that, odds are you're dealing with a mold exposure. So think of something even like a penicillin. Penicillin is a mold. It kills bad kind of bacteria. Problem though is that if you already have mold in your system and you give it even more, it just amplifies and things feel much, much worse. The other one, and again, this one is more just observational. If you've ever been diagnosed with something called mast cell activation syndrome, my experience is that mold is one of the underlying driving factors, not something to be messed with. The last things in terms of your overall lifestyle that can lead to this imbalance of the digestive system is going to be, simply put, way too much stress. Stress in and of itself does not create problems, but what it does do is it amplifies them. It's like there's already a small burning fire, and then you add dry conditions and a big gust of wind to it. It's going to amplify, make it worse, but also then lack of sleep. Anything that essentially fatigues your brain is going to fatigue the neural communication, the neural control going on in your body. It causes disruptions with your hormones. It also causes disruptions of the immune system. And so instead of your body being able to maintain healthy equilibrium, that equilibrium shifts for the worse. So I've just gone through all of the different kinds of things, and truth is there are more that can lead to some of these imbalances in your GI tract. But I want to let you know these are some of the things that you can do that are now going to promote healthier balance. Again, not just for the sake of your digestive system, but of course that's huge. We are what we absorb. We need good nutrition, good diet. It is one of the single most important things that we can do for our health, for our well-being, to get rid of inflammation, to make sure that all systems of our body, including joints and bones, are working as good as they can. And I repeat, it's not like, oh, here's this one magic thing that you need to do. No, this is a lifetime process. But I want to let you know some information that'll hopefully direct you in the right way. So number one is if you have been taking long-term antibiotics, even if you needed to, because again, it was necessary to save your life, you have to deal with a blank slate. What this means is it means you need to, number one, reestablish a good, healthy environment so that the new good bacteria that you are putting into your body are able to sustain themselves. This requires, and I know the order might be a little bit backward on my slide here, A diet that is good in saturated fats. This is going to be organic butter. This can be good quality organic coconut oil. It can involve psyllium husk, which has a large amount of fiber. So it just sort of is laying the foundation. It's what's known as prebiotic treatment. After you've done that, then you are going to be wanting to take a probiotic. These are little capsules that you can usually find them in a good quality health food store in the refrigerator. They have to be stored in a cold environment. And there are many different brands. I'm not a nutritional expert, so I'm not going to say this is the best one. But as a general rule, what I can say this is that the more different types of strains that there are, the better it's going to be for you. You can also support this by taking and eating fermented foods. So kefir, fermented yogurt, assuming that you're not dealing with lactose intolerance, different kinds of things like that. But it can also include cabbage, so sauerkraut, different kinds of things, fermented fruits and vegetables. This is part of that prebiotic treatment so that probiotics are able to reestablish themselves in a healthy way. Now, in addition to that, you also need to be making sure that you are supplying your body with the raw minerals and ingredients that it needs to help rebuild healthy bones, healthy joints, healthy ligaments. In no particular order, and this is not an exhaustive list, but number one is actually going to be magnesium. It is the number one mineral deficiency for people in the Western world. Ironically, it's not calcium. We oftentimes think you need calcium for healthy bones and healthy teeth. Magnesium is actually far more important. You also need to make sure that you are having good quality amounts of protein. Protein is the building block that everything in your body is made of. Protein's the building blocks, sugar is the fuel, and then fat are the containers. If you need to rebuild structures, number one, you need to make sure that you're giving your body protein, but then number two, that you are doing weight-bearing movements. This can be as simple as walking. It doesn't have to be aggressive. It doesn't have to be hard. It doesn't have to be serious. It just means regular. Certainly, weight training helps towards promoting healthier bones as well, but you can do things one step at a time at the pace that is comfortable for you. So again, there's no magic one-size-fits-all solution here, but lots of things that you can be doing from a dietary standpoint that help to restore that normal balance. Again, not just for the sake of your digestive system, but also because of what it means to your overall bone and joint health. So I hope you enjoyed that little video. If you did, please do make sure, again, you click that like, subscribe button so other people can find this information. And also feel free, share this information with friends, family members who you think would benefit from checking this out here. If you'd like more information on any of the topics that we cover here, please do check out my other videos on this channel. And if you'd like more information to find out what we can do to help out you in your individual health journeys, you can find us at clearchirospokane.com. Thank you guys again. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well.